Hi, this is Dr. David Skaggs. I am the co-director of the spine service at Cedars-Sinai. I'm also the executive vice chief of orthopedic surgery and the director of pediatric orthopedics. You're listening to Interview with the Surgeon with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. David Skaggs, Vice Chair of Orthopedics and also the Co-Director of the Spine Center at Cedars-Sinai. Doc, how are we doing today?
Good. How are you today? It's nice to see you.
Nice to see you as well. So, getting started, what were your goals and aspirations during your residency, and how did those change throughout your fellowship?
Well, during residency, it was interesting. From a specialty standpoint, I still remember seeing my first scoliosis surgery and walking out of the OR and saying, that's what I want to do for the rest of my life. I want to take on the biggest cases. I want people to come from all over, and I want to do these cases. And for some reason, scoliosis surgery just stuck with me. And I still love doing it every single day. You take somebody who's deformed physically, and they can't help having some aspects of that affect them mentally. And generally, the kids leave the hospital 1.5 inches taller, and they look less deformed. They can go on and live a normal life. So we are very lucky in our profession that we truly get to change lives, take people out of pain every day. And that's kind of why I got into this, and it keeps me coming back every day. I have to honestly say, there's never been a day that I wasn't looking forward to going to work as I drove in.
So kind of taking us through that fellowship year and entering the job market for your first time, what was your mentality and how did that perspective change in the beginning years of your career?
Okay, so from going to fellowship to your first job, that's a big topic. Mine was actually kind of funny. I did fellowship at Children's Hospital Los Angeles. Dr. Vern Tola, who's been the president of everything, I thought was a top pediatric spine guy in the world at the time. So I did my fellowship with him. In 2 months, he said, will you be my junior partner? I'm like, I'm on board. Let's do it. And many hospitals, as you can imagine, have financial problems, and it became evident that there was not the finances to hire me. So at the last minute, I went to Alabama, in Birmingham, Alabama. And it was interesting. People always see these ads of, go to Florida, you'll be paid an amazing amount of money. And young residents and fellows just can't help look at those jobs of like, wow, you walk into this job, you're going to be paid 7 figures. It's going to be amazing. And, generally there's reasons why some of those jobs pay a lot. And it was interesting walking into a situation where I felt like there were resources available. And for various reasons, it wasn't the place for me long-term, but I think it's fantastic to see different places. And it was one of the best things I've ever done in my career to realize, even if you go to a resource-heavy environment, it doesn't mean that you're necessarily going to be in a good job. Resources by themselves don't equal good job. More important than that, I think, is mission and is the culture of the first job you take. One of the things I like to tell my fellows is when you're looking at your first job, near the bottom somewhere is your income. The top should be mentorship and culture. Is the person hiring you, are they secure in their job, number one? And you'd be surprised how many people who are even, chairmen or big names are still maybe a little bit insecure and still feeling like they might be competing with the person they're hiring. So you're to make sure you work for somebody who's very secure and who views your success as their success. And some bad examples are, I've seen many times, is a relatively successful group wants to hire a junior person to cover overhead. They figure you hire the junior person and maybe they'll cover overhead. Maybe they'll see all the non-paying patients. Maybe they'll take call. Maybe they'll round on the weekends. So try to be very clear, why is this group offering me a job? And one of the kind of tricks to that is, ask the person who's in charge of hiring you, where do you see me in 10 years if this is successful? And if they look blank, run away. For academics, the answer I would want is, well, in 10 years, I hope that you have a busy clinical practice. I hope you have research opportunities. I hope you're on stage. I'd like to see you a member of a few committees, moving up some national organizations. So be very, very clear in what role they want you to fulfill. One of the other areas that I see new jobs fail is how cases are triaged. So if what you want to do is pediatric spine, and they really want to hire someone to just do, hip fractures in old people, that's not going to be a good match. And I think that this might even start very early in your career, such as residency. Like if you know as a resident, you want to go back to your hometown and practice, it is never too early to start making inquiries into jobs. So to be honest, a chief is looking for good hires with every bit as much enthusiasm as you are looking for a new job or your first job. So if you know you want to be in a certain town, I'd recommend contact the biggest and best groups there, contact whoever's around and let it be known that you want to start working there in 3 or 4 years. And you might take some pressure off of people who are going to be looking for someone. And you could even sign an agreement years ahead of time. I've seen more than once. It could even be an agreement where they might supplement your income during your residency and fellowship with the agreement that you're going to then come work for someone. So it's an interesting mindset change in when you're getting from college to medical school to residency to fellowship, you're kind of competing every step of the way to get up there, and you feel lucky that you've made the next step. Now it's all different. When you get your first job, they want you as much or more than you want them. Now, part of it, honestly, is orthopedic surgeons tend to be cash cows, for any hospital or any group. And correct me if I'm wrong here, I might have my numbers a little bit off, but if you look at some of these statistics on how much money does an orthopedic surgeon bring to a busy hospital, I think it's something like $3 or $4 million. So, if the orthopedic surgeon is paid $300,000 and you're bringing in $3 million, hospitals want you. They want many of you. You're bringing more to the table possibly than you're getting. And I think that many residents and fellows, they are just not used to the concept that they are bringing so much to the table, that they are valued. So then other concepts. One, it's never too early to start making it known you're interested in a certain area or a certain job. And what you may find out is they say, no, we'd love to have you, but we don't need a hip surgeon. We need a foot surgeon, or we need a pediatric person. So if you're really stuck in one area or one group, find out what they're looking for, and that might help direct you towards what fellowship to do. And even within that, within a spine fellowship, they may be looking for someone to do deformity or MIS or whatever role it could be. Find out who they really want to hire. And then also, one of the things you might want to have in writing is how are patients triaged? I have seen firsthand groups where the boss wants all the good patients sent to him, however you want to define good patients. It could be a certain type of surgery, it could be a certain type of insurance, and the other people take everything else. So you may want that defined. And then this leads to another point. In your first job, the contract. And I've seen things go south with the contract. So basically, the bigger the institution, the less you're going to change the contract. If you're going to a major university or medical center and you're coming straight out of fellowship, I think you should accept the fact that you are not going to change that contract. It's a boilerplate contract. And if in fact you hire a lawyer and they start marking up the contract and giving it back to people and going back and forth, it could be viewed as a negative. In fact, one of the people that I should not have hired, the first red flag, is they had a lawyer come in and mark up the contract a whole bunch, put everything on hold for months and lots of bad feelings. And I should have just realized, hey, if somebody's being this confrontational at this point in the game, you probably shouldn't hire that person. Now, however, there are good ways to get things in writing, and you should, that are not in the contract. It's called an email. So all you need is an email, from your new boss to you or some conglomeration of important people in the organization. So there's a good paper trail, just stating things that aren't in the contract. And it may be, for example, you'll be on call every third night, or it may be that spine patients will be triaged to you, or how much vacation you get. So if there's any kind of issues that are important to you, research time or whatever it is, and it's not in the contract, put it in an email separately. Now, if somebody's hesitant to do that, that's a red flag. If they really expect that they're going to be able to offer this to you, they should be able to put that in email. And I've been told that emails are legally binding. And even if you don't, do the legal route, which hopefully you never will have to do, and I never have, just having something in writing allows administration to take it more seriously and generally go along with what was in writing.
Now, thinking back, what would you say were some of the keys of your success that shaped your early career that allows you to climb the ranks in the academic world?
Yeah, it's, I don't want to sound like the old person here, but I'd say part of what helped me succeed early in my academic career was working hard and, being ambitious, and ambitious shouldn't be a dirty word. So I said that Sunday mornings from 6 a.m. to 10 a.m. was my research time. And I had young kids at the time. So I would drive into the office 6 a.m. every Sunday and for 4 hours get my research done. Maybe that's not popular now. Maybe it'd look like you don't have family life balance. But that's what I did. Now, I don't really expect people these days to do that. And if I hire somebody who's going to do research, I say up front, my job is to hire a researcher. Research is tougher now. It needs to get through an IRB. There's lots of paperwork. There's grant writing. So I think if you're going to go into an academic job and you're expected to produce research, you should not be on your own. You should have full-time researchers who are going to make it easy for you. But way back in the old days when I started 25 years ago, it was honestly just due to hard work. And I think that our society is leaning towards there's always somebody to blame and people are entitled, and maybe things should be given to you instead of working for them. And that really is not the way it is the first few years of practice. The first few years in practice, I think you should plan on just working your tail off if you want to really succeed and become the person that everyone sends patients to. In medical school, they always talk about affability and availability and ability. And, availability may be the number one. If you're not just physically there saying, yes, send the patient over immediately, the patient won't come to you. And it's amazing how many young people's practices I've seen never take off because they're just not that available. If you think about it, the internal medicine doc, the family practice doc, pediatrician, whatever, if their office calls you and you say no, they're not going to call you again. They're going to call someone else because there will be someone down the street whose answer is always yes, come right in. So that's how to get busy clinically. The answer is always yes, come right in. Academically, work your butt off and choose carefully. If you really want to produce papers, you should go into a job where people produce papers. There are cultures that produce research and there's cultures that don't produce research. And I think that you need to look very closely into, does the job expect you to write? And do the other people there successfully write? And how much support are they getting?
Now, as a leader in the department, what are you looking for when medical students are applying for residency and when residents are applying for fellowship positions?
So applying for, it's interesting. So apparently now the board scores are no longer going to be looked at for choosing residents. And, if it goes to kind of a pass-fail thing and that's off the board, what is left to select residents? One thing is research. Another thing is, did you do a sub-I somewhere? Do people know you? Another is letters or phone calls from trusted colleagues. And it's kind of ironic. I think they're trying to somehow make things more fair by not counting board scores, when in reality, that's one of the truly objective measures there are. So I'm afraid that it might almost have unintended consequences. But I would say the number one thing I look for in hiring a partner, a fellow, or a resident enthusiasm, enthusiasm, enthusiasm. People who want to be there, people who are excited about orthopedic surgery, people who want to come to work. And if, the first questions you're getting, and I've heard this in job interviews, is now how much vacation is there and how much call is there? And, I really want to work on my life balance. If they're bringing that up in an interview, that would concern me a bit. And if you don't mind, I would like to talk about, life balance a bit in family life. I have pretty strong opinions on this. So my kids, one of them is a fourth-year medical student who's hoping to match an ortho right now. She's in her sub-I. Another one is 2 years out of college, and she's the first employee at a biotech hedge fund. And my son wants to protect the country, and he's on a scholarship in college right now. So I think they're, fairly happy, fairly successful, mission-driven kids, and we get along great and text each other a number of times a day. And looking forward to going on a 9-day family vacation with them later this month. So I feel that my kids are successful. We've had a good family life. I don't feel that that's been sacrificed. And at the same time, I did work my butt off, but there are a few things that you can do as a parent, I think, to be a good parent and to be a successful surgeon. Number one rule is for little kids, if you're there, give them full attention. I honestly would virtually never work at home for the first 10 years of my kid's life, because if you are physically there and ignoring them, they get the message that they're not important. And that's why I'd run in every Sunday morning and do research. If you're not there, you're not there. The kids just don't notice. I made fellowship rule that I'd never go home before 6:30 at night to kind of get my work done. And then when you're home, you're there 100%. Your kids think that they think that you think they're the most important thing in the world because they don't see you paying attention to anything else. Another little trick was there was no TV in the house. I guess that would be today like having no computer or phone in the house. I don't know if that would work. And the other thing, my wife, who was also a surgeon at first and is now an entrepreneur, owns her own healthcare company. It came out from the World Health Organization just as we were starting a family that the number one thing that they found across happy families and engaged children was family dinner. It turned out it didn't really matter how much the parents made, if the parents went to college, how much vacation, it was just family dinner. So as long as I wasn't traveling, I would say I was home for family dinner all but one day every month or two. I say this and people don't believe it, but I really wouldn't miss family dinner for 2 months in a row because that was important. If you had to do something afterwards, if you had to go back to the hospital, fine, do it. But I think being home for family dinner and letting the kids know that they have your full attention and they are important to you really helps. So I think the whole idea of family, or I should say work-life balance, family-work balance, it's doable. It's not necessarily in competition with each other as long as you do each of them well. And I don't think you should overlap the two.
Now, you're involved in different societies and also communities, including SRS and Ortho Bullet. Can you please talk about those? And also, what access are you providing to the next generation?
We talk about Ortho Bullets a lot. Now, probably anyone listening to this podcast knows what Ortho Bullets is. It gets 100 million page views a year, which is just astounding. And it originally just started out helping residents study for tests. And it very quickly started to have a lot more than just studying for tests, but case presentations and really almost an online textbook that's constantly being upgraded. So I'm the co-editor in chief of Ortho Bullets, and I found it really rewarding to keep up my skills. So I am constantly looking over questions, looking over chapters, reading papers, making sure that Ortho Bullets is up to date, and it keeps me up to date as well. And what's kind of neat about it is we've had a shift. I've done other paper textbooks, Rockwood and Wilkins, Fractures in Children, and then Staying Out of Trouble in Pediatric Orthopedics. I wouldn't say any of them are bestsellers, but within our little profession, they seem to do okay. And there's been a very clear shift away from paper texts towards something you can have on your phone. And I think that is the future. And, for us to ignore it, we're going to be lying to ourselves. So I think what we need to do is just accept the fact that we all want to pull up any answer we want to right on our phone right at that moment, and we could probably give better patient care and look like an expert, when you have a patient in your office right there. And I don't hesitate to tell patients like, well, let me Google this and think about it for a while and I'll get back to you. And then things like professional societies. It's essentially volunteer work. And, over time, I think that there's probably less interest in people putting in a lot of volunteer work, whether it's a professional organization or other organizations. But it really is giving back, and it really adds a richness to your life and puts you in a situation where you can become friends with people from other groups and other states and universities and people that, maybe you could view as competition. All of a sudden you're working with them, and they kind of become a support group. I have 4 friends, some of my best friends in life. We probably communicate almost every day with each other. One of them is the chief of peds ortho at Children's Hospital Philadelphia. One of them is at Boston Children's. One of them is Columbia University, and one of them is at University of Wisconsin at Madison. And it really helped having these other very motivated, very accomplished people as friends at first, just to support each other saying no to things. At first, what you should be doing is saying yes to everything. Yes, I'll do that paper. I'll teach that course. I'll go to that meeting. I'll cover that satellite office. For the first 5 years, think of your career as just saying yes. And if you do that successfully, you're then going to have to start to learn to say no. Because if you do too much, you will drop balls. And unfortunately, one of the balls that is very hard to recover from, if ever dropping, is patient care. If you hurt a patient or don't give patient good care because you were too busy, it will be hard to ever forgive yourself, and people will start to notice, and you won't enjoy your career so much. The average orthopedic surgeon gets sued every 2 years. So I'd say very, very quickly, start to figure out, if you're getting too busy, what are you going to say no to? Look to peers to support you at saying no for things, and look to peers to help you decide what to say yes to and what to say no to. There's something called the Peter Principle in business, where you get promoted to the point where you're incompetent. And it's almost like that in hospitals and professional organizations, where anyone who does a good job, they get more and more work poured on them until they don't do a good job. And what you want to do is somehow not get to that point where you're not doing a good job, and learn to say no, and I'm busy enough now, and I'd love to take that on, but I'd have to take something else off my plate. Scoliosis Research Society. Well, I've been on the board now for 2 runs. I've run the annual meeting when it was in Edinburgh, and now I'm the treasurer. So I'm about to be the treasurer, I think. Hopefully I will be accepted in the committee's recommendations to be treasurer in September. And then I'd be looking at 4 years, on the executive committee to help run the Scoliosis Research Society. And it is an absolutely wonderful society. I love going to the meeting every year, because you learn, 1, what's new, 2, what's not working. And because the course of anything, when anything comes out, everyone is excited about it, and it's a marketing tool, and maybe people are jumping on the bandwagon. And it's often not until you start seeing things presented at meetings that don't work so well. And particularly at the SRS, I have found that some of the meetings you have in the hallways, or maybe over a beer at night when people are brutally honest, is where I've really learned things that have helped my patients and helped me to run a better practice. So even though it's becoming, very easy now to attend a meeting online, I'm afraid that almost may be missing half the importance of the meeting. And particularly for young people who are so comfortable doing things virtually, if you're not showing up and maybe having a beer with someone and chatting honestly at the end of the night, you might not be getting the same information that really is important information to get if you're not there physically present. So I would encourage people, at least for 1 or 2 meetings a year, get on an airplane, be physically present, meet people. You really do make friends with people. You'll socialize with people. You'll be happy to see them over years, and it will definitely enrich the pleasure of your professional life, and it will really help you probably run a better office and give better patient care. Those little one-on-one discussions seem to be what oftentimes changes patient care quite significantly.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.